From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. Today our show is focused on diabetes. It's the 7th leading cause of death according to the American Diabetes Association. Over 1 million Americans will be diagnosed with diabetes this year. But the good news is that diabetes can be managed and even reversed in some cases. A diagnosis doesn't have to limit your life, and some types can be prevented. Today on 22 News in Focus, we're discussing diabetes with Dr. Chelsea Gordner, an adult and pediatric endocrinologist with Bay State Health, and 22 News Storm Team meteorologist Kelly Reardon, who is living with diabetes. Thank you both for being here with us today.
Thank you.
Absolutely.
So, Dr. Gordner, my first question for you is, what exactly is diabetes? We hear this word, but many people might not know exactly what it is.
Sure. Diabetes is when your blood sugar levels are above normal. And there's various different types of it, but in general, the blood sugar levels are too high.
And what about the different types? There's type 1, 2, gestational.
So type 2 diabetes is probably more common, most common, and it's related to typically lifestyle behaviors, being overweight, poor eating habits, and ethnicity. Type 1 diabetes is different. It's related to your immune system attacking your pancreas, and your body no longer makes insulin.
Yeah, and how does somebody initially find out they have diabetes? What are the symptoms?
So the symptoms can vary. Most of the time there's excessive thirst, excessive urination, sometimes blurry vision, and in type 1 diabetes it can be more aggressive. So you can have trouble breathing, rapid weight loss, dizziness.
Yeah, Kelly, so can you talk a little bit about what it was like for you, how you found out?
Yes, so I actually had all of those symptoms. I woke up one morning, I wasn't diagnosed till I was 18, so it's a little bit later than the average type 1 is diagnosed. I actually woke up one morning and my vision completely went. It wasn't black or anything, but my own mother could be standing a foot away from my face and her face was completely blurred. So I essentially couldn't see. So I immediately went to the nurse at my university. I was also hunched over because I thought I pulled a muscle in my back. Turns out I had a kidney infection. So I talked to my doctor. Essentially, it took her 5 minutes to say, well, you know, let's check your blood sugar. Does diabetes run in your family? And type 2 does, but type 1, not a single person in my family has it. And she immediately checked my blood sugar, and it was so high the meter couldn't actually read it. It just said HI on it. And it took within the next 20 minutes to be rushed to the hospital, essentially to be diagnosed. Also another symptom is weight loss. So I was 5'7", I am 5'7", and I weighed 90 pounds before I was diagnosed. I was extremely tired, but of course I was a freshman in college, so I thought this was normal. Drinking 30 to 40 water bottles a day. I went to college in Florida, so I thought, you know, maybe I'm not used to the heat. Maybe this is, so all of these symptoms came together after I went to the doctor, and it didn't take very long for them to diagnose me.
Yeah, that's really scary. So, of course, you said you were in college. You know, going through studies can be really stressful. So what would you say to other students if they maybe, you know, they're really tired, they're really thirsty, their vision, maybe they think they're just overtired? What would you say to them?
I would say don't overlook it. I mean, of course, there's the normal, I'm going to be tired and stressed, but this was at a whole different level than what a college freshman should be going through. So do what I did and talk to people. I actually had a friend who was diabetic, which at the time didn't really understand what type 1 diabetic meant, so he was talking to me about it, but I still didn't even connect those symptoms. So just go and ask for help, you know, talk to a medical professional and tell them what's going on and say, hey, is this normal or is this not normal or something different?
And so you were saying that you were, you know, a little bit older, but our other question is, you know, children and diabetes, what's that diagnosis like?
So type 1 diabetes is more common in children. It definitely can occur in adulthood as well, but more often than not it's being diagnosed in someone under the age of 20. We do have adults that can develop type 1 diabetes really at any age. Not too long ago I diagnosed type 1 diabetes in a woman who was 92. So it really can happen at any age, but more common in childhood.
And so Kelly, how has this impacted your personal and professional life?
It's really tricky, you know, obviously as a meteorologist and a reporter here, like I have a lot of duties every single day. I'm very, very busy, but I always have to keep in the back of my mind, I have to make the time to stop, check my blood sugar, If it's too high, take an insulin injection. If it's too low, I keep, like a juice box with me or something like that. I always have to have that in the back of the mind, because if I wait too long, it could be a serious issue. If I'm out in the field and say I'm doing an interview with someone, I definitely had to get comfortable with saying, hey, do you mind if I take a second, pause this interview? I think I have low blood sugar, which if untreated can be extremely dangerous. So I had to get comfortable with trying to explain to people that I need a second, I need to do something. Do you mind if I have about 10 minutes to feel better before I come back and resume this? So it's tricky. And there have been nights where I've woken up and I've had a little bit low blood sugar that was steady all night. And when you wake up, when you've been low all night, you're absolutely exhausted. It sets my whole day off. So sort of getting back to that energy level can be really, really tricky sometimes.
And you've been really open about your condition. So, there might be other people out there in the media that also are struggling with diabetes, but what would you say to them if they, haven't been so open with their viewers about it?
I would definitely say be open about it. If you actually go to my Facebook page, the first thing you'll see is this video explaining the continuous glucose monitor that I wear on my arm, because sometimes on the air, especially in the summertime when I'm on the weather wall, you can clearly see it. So I've actually had a lot of positive reaction from that. At first I was really shy and I was trying to cover it as much as I could because not everyone understands. But people have reached out to me saying, I just want to say thank you. My 6-year-old little child, saw you doing the weather, and I can't tell you how excited she was to see that. And it really touched me. So I would tell the other people in the media to try to be open about it. Obviously, it's not easy for everyone, but it honestly can bring some good reaction from it.
All right. And when we return, we'll be discussing how someone is diagnosed and the risk associated with type 1 diabetes. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about living with diabetes with Dr. Chelsea Gordner, an adult and pediatric endocrinologist with Bay State Health, and Kelly Reardon, a meteorologist here who is living with diabetes. So our first question is, how many Americans have type 1 diabetes and why is it so dangerous?
So type 1 diabetes, it accounts for maybe 5 or 10% of all patients with diabetes. So I think there's about 1.2 million Americans that have type 1 specifically. And the reason it can be so dangerous is you cannot miss your insulin really ever. There's 2 types of insulin that people with type 1 diabetes use. And if they miss their basal insulin even one day, they can get really, really sick.
And at what age are most people diagnosed?
It's definitely more common in pediatric patients, so most kids are diagnosed under the age of 20, but we do see adults developing type 1 diabetes occasionally as well.
And Kelly, for our viewers just joining us, you were saying you were 18 when you were first diagnosed?
Yes, I was 18, which is probably why it shocked my family so much, because they heard of type 1 diabetics, but most of the ones they knew were like 5, 6 years old, very, very young children. But yeah, I was a little bit older.
And let's talk about managing type 1 diabetes and what insulin does.
So insulin, its main function is to lower blood sugar. And so there's different ways to manage type 1 diabetes. You can use an insulin pump, which the person wears continuously, so 24 hours a day, and they change it out every 3 days or so. Or they can use insulin injections, and there's 2 different types of insulin injections. In general, you need to take about 4 injections per day.
Yeah, and Kelly, what about you?
I'm currently on injections. I was on an insulin pump for a long, long time, and I really loved it. But recently, it's almost a mental health thing. I kind of just needed a break from it, and I've heard of people doing this actually, because you're hooked up to a machine all day, so it's very visible and it's in your mind that you can't even forget about it for a second when you're hooked up to this thing. But I completely understand why people do it, and I might eventually actually go back on one, because since I'm not on an insulin pump, I take 6 insulin injections every single day, and that is a lot. That is tens of thousands that I've taken since I've been diagnosed 7 years ago. So it can be really tough. And like she said, if I miss one, I can get extremely, extremely sick. There's one that I have to take when I eat food. Generally, it helps my blood sugar if I take it about 15 minutes before I eat, because it takes a little bit to start working. But there's this one that's long acting that works 24 hours in the background. So even if I ate no carbohydrates, which is, we need to take insulin for the carbs we eat, not just the sugar. Even if I ate no carbohydrates, if I somehow lived off kale and water, I would still have to take this insulin every single day. I'd say that's like one of the biggest misunderstandings. Is no matter what I eat, I still have to take my insulin every single day.
Yeah. And so what are the steps when someone's diagnosed?
Well, often type 1 diabetes, similar to Kelly's experience, it really kind of comes on like a freight train. You know, within 1, 2, 3 days, you're critically ill, and many patients require hospitalization. And so when you're diagnosed, it requires immediate initiation of insulin and meeting with someone to kind of teach you about diabetes, because it's really life-changing in many ways. You have to learn about your food, how to match the insulin to cover your food, and how to inject yourself with insulin.
Yeah, and Kelly, you were saying that, if you miss a shot, it can be really scary. So let's talk about, low blood sugar. What is that? What is it like?
So as she was saying, for how much insulin to cover what you're eating, there's what's called an insulin to carb ratio. I have to take my specific one, it's different for everybody, a unit of insulin for every 4 grams of carbs that I eat. But it's different as I go throughout the day. In the morning, it actually might be 1 to 4, in the evening 1 to 10, because I become less insulin resistant as the day goes on. So if I'm off by just a few grams of carbs, which given the size of the meal, the more carbs it is, the greater room there is for error. If I'm off by just a few grams of carbs for my insulin, I can get dangerously low blood sugar. But it can also happen from stress, from rigorous exercise. If I'm spending a day outside in the hot sun, just sweating itself can plummet my blood sugar. So it's really scary. There have been nights where I've woken up so low that you almost lose control of your bodily function. So I had a hard time just walking to the refrigerator to get something to drink, because my muscles were that exhausted, and you're essentially, your life is being threatened. It's very, very dangerous and scary.
And what about just everyday things like going out to eat at restaurants, meeting up with friends, things like that?
So I like chain restaurants because they have nutrition menus. I'm sure you understand that is very, very helpful, because I just pull it up on my phone or I'll ask them for it. It's really great. But then there's also, how much are you going to eat? Chain restaurants, it's a huge plate. So it's like, do I take half for this now? Take half, and then if I start eating more, I'll take more insulin. But at home, it's a lot better control, because I have a nutrition scale. We were just talking about this over the break. I have a nutrition scale. So my favorite snack is grapes. So every single day I have to get a plastic bag, put my grapes in, put it on the nutrition scale, count out exactly how many grams of carbs in it, because even a few grapes, less or more than what I'm eating, could give me high or low blood sugar. So when it's at home, it's a lot easier to manage.
And Dr. Gordner, diabetes has been associated with other health complications. Could you tell us what those are?
Both forms of diabetes can impact various parts of your body. And so we think about the eyes. It can damage your eyes, it can damage your kidneys, and it can damage the nerves in your feet. It can also damage your heart, and it can damage the blood vessels.
And what about the risk if someone isn't diagnosed correctly?
As far as if they're misdiagnosed with type 1
Right.
or type 2 diabetes? Right, so since type 1 diabetes happens more in children, I think sometimes providers are less likely to think about it when an adult develops type 2 diabetes. So if they're incorrectly diagnosed, perhaps they're put on the wrong type of medication. With type 1 diabetes, insulin is the only option. And so there really are no pills that you can use to treat diabetes. So if they're started on pills, their diabetes will progress rapidly, and they could get very sick.
Okay. And you at home might be wondering if diabetes can be managed. Well, we'll be back with those answers for you after the break. You're watching 22 News in Focus. You're watching 22 News in Focus, and today we've been talking about living with diabetes. A lot of parents have to manage their children's diabetes as they can be diagnosed very young. And what challenges does that pose to parents?
So yes, children can be diagnosed as young as age 1, 2, 3. And if you can imagine, I don't know if any of our viewers have kids, but if you can imagine you have a toddler who's picky about the food they eat and their activity levels vary, In general, with diabetes, when you sit down, you have to plan your meal, and you take insulin before the meal based on what you plan to eat. But with a toddler, you never know if they're going to eat what you put in front of them, so that is very challenging.
And are there any risk factors, and what are the long-term issues? How can those be managed?
So the main risk factor in developing type 1 diabetes is family history and having an autoimmune condition yourself, like a thyroid problem, an adrenal problem, something like that. If you have a first-degree family member with type 1 diabetes, a parent with type 1 diabetes, that would be the highest risk.
What about how much insulin does a type 1 diabetic have to take?
You know, that varies a lot. I see very varied insulin doses. It really depends on the patient. In general, patients with type 1 diabetes do require less insulin as compared to patients with type 2 diabetes, but it does vary.
And we talked about this a little bit earlier, but for people just joining us, can they live without their insulin even if they eat no carbs?
They cannot live without insulin for even a single day. Your body goes almost into shock. It's something called ketoacidosis, and your body's acid levels start to build up. You can develop severe abdominal pain, vomiting, and trouble breathing, and it's an emergency.
Yeah. Kelly, could you just share with us what your treatment plan is?
I talked about this a little bit earlier, but I'm on 6 daily injections, so I'm not very hungry when I first wake up in the morning, but I like to check my blood sugar and correct. So I take a unit or so of insulin in the morning. I'll take it when I eat breakfast, maybe a few hours later. I always have a snack during the day, and then I take it for lunch and dinner, so that's already 5. And then I have the 24-hour long-acting insulin I have to take that I generally take in the evening. So that is 6 hours. But to check my blood sugar, I'm actually what's on called a continuous glucose monitor, because to check my blood sugar up until 6 months ago, I had to prick my fingers, 4 or 5 times a day, especially with type 1s. We have to do it a lot more anytime I don't feel well or anything like that. And that gets a lot. You prick your finger, you hit a nerve, it will bruise and it hurts to just touch things. So I have a continuous glucose monitor on my arm. It's this little machine that essentially has this little plastic cannula in it, kind of like what an IV is. It goes in with a needle, but the needle retracts and there's a little plastic tube. And I actually just get my phone and I tap it to this to read my blood sugar. So this is, it's been amazing for me. I've been exhausted in the middle of the night and I wake up, and instead of having to take out, all my blood sugar reading stuff, I literally just grab my phone, tap it here, and it tells me what it is. So I will test my blood sugar now that I have this thing, 15, 20 times a day, because it's so easy now. And it also really helps me tailor my insulin dosage needs. So if I was finding that over time I was actually spiking a little bit right before lunchtime, because it actually saves glucose data every minute that I have this for 8 hours. So my doctor would be like, oh, I've seen that you go a little bit high before lunchtime, maybe try taking more insulin at breakfast, or let's up your long-acting insulin a little bit. So this gives us a better idea of exactly what my blood sugar is happening, versus if you're only checking 4 times a day with your blood sugar pricks, you're not getting the full story of what's happening in between the readings.
And so is that an app that you can use for people maybe who have diabetes at home and they're interested in this and they don't know about it? Is it an app that's on your phone?
Yes, it is an app I have, but there are multiple companies that have glucose monitoring devices. For young kids, what's really great is some of the parents can actually look at the monitor from what their kids is. So their children can be at school and they can look at their blood sugar on their phone to see how they're doing. They can get alarms when their blood sugar is dropping quickly before it gets too low. So it actually is absolutely incredible, and has no doubt been saving multiple lives of people with type 1 diabetes.
Yeah, technology, huh?
Mm-hmm.
Kelly, could you talk about tips maybe for diabetics to lower their A1C and what that means?
So of course, with type 2s as well, generally speaking, the less amount of carbs I eat every single day, the better control I have, because the more carbs you're eating, the more insulin you have to take, and the larger room there is for error. I like to take my insulin about 15 to 20 minutes before I eat, because it takes time to really start working in your body. It doesn't immediately drop your blood sugar. And having a glucose monitoring device also has been helping me change my doses over time. Every single time I go to my doctor, every 3 to 6 months, we change something a little bit. So that has helped dramatically reduce my A1C.
And I think this is something you can both chime in on. A lot of people think that diabetes significantly limits the foods that you can eat, but that's not always true.
No, I completely agree. We don't want patients to think that they are barred from sweets, they're barred from, really anything. It's really, eating a healthy diet and watching the portion sizes and matching the insulin to cover the food, but we don't restrict any food.
Right. Yeah. My doctor's talked to me. He's like, we've done your blood work. You're very healthy. We don't want you to significantly change your diet. So it's okay to have a piece of pizza every once in a while and celebrate your birthday. The more carbs you eat, the more accurate you have to be with how many carbs are in it. So might get a piece of pizza from a local place or from a chain, but I can find that carbohydrate information online and figure out exactly how many carbs is in that slice of pizza. Would I want to eat it every single day? High carbs is not great over time, but generally speaking, I actually can eat a pretty normal diet as long as I can measure and count what's in it.
And lastly, under what circumstances can diabetes be reversed?
So in type 1 diabetes, we don't really have a cure yet. I do believe in my lifetime it's going to happen. I'm confident. In type 2 diabetes, it responds very well to diet and exercise. So depending on how advanced the diabetes is, you may be able to manage it with diet and exercise.
All right. And after the break, we'll have the last word. You're watching 22 News in Focus. Today on 22 News in Focus, we've been talking about living with diabetes, how it's diagnosed, treated, and managed. We hope we answered all the questions that you might have had on this condition, but that is it for our program today. We want to thank our guests for joining us. Thank you so much. And of course, thank all of you at home for watching. If you missed any of it, you can find this week's conversation in full on WWLP.com. From all of us here at 22 News, have a wonderful day.